Thanks so much. Thanks, Redox, for having us. We know this is a trying time for many. As a nurse, I just want to send out our gratefulness and our just thoughts and prayers for those who are on the front line, so many on this presentation. So I know you guys are fighting the good fight, and so we're sending our best, and we're hoping that our tool is able to help support those who are on the front lines and wanting to do the best for their patients. So at Locus, we've designed a platform that helps with bridging the gap between hospital and home. And so by that, we want to make sure that across all of our patient populations, and we serve so many, and we're able to, and I'll get to how we're able to do that, but that we're creating a connection that is configurable for patients based on what they're going through. So with the care team, they're able to design a program with us and utilize the capabilities of the platform to configure and tailor data points, surveys, tasks that are appropriate for their population and able to stay in touch with their patients at home effectively. And so extending the care that they have been providing at the hospital into the home and continuing to track that necessary information and really kind of avoid that feeling of a patient rolling out of the hospital and having such close monitoring. And then when they leave and get home, then they have no idea what they're what they need to do or how they're going to do it, or what they need to track. And so this keeps them engaged with their care team. And also the ability to share that information across their care team with numerous providers and having the clinicians having access to secure dashboards with patient summary reports and those alerts called out to them so they can attend to the things that they need to. Excuse me. And also giving mobility to our clinicians. So we have an app that's a part of the platform that the clinicians are able to download to keep them mobile and on the go when they're trying to respond to these needs of patients, because we know that a lot of our clinicians are not just sitting at a desktop looking at this information. So how do we actually do that? We do it via the iPad. So our platform is the patient-facing portion of the platform is an iOS-based solution. It is very interactive and is for a patient, and there's real-time data submission from the patient back to the clinical team. So like I said before, there is an array of data points. We have over 80 data points configured into our platform that clinicians are able to pull and push those data points out to patients based on either their disease process. It can be very specific from adults to pediatrics, anything from very particular ways in which they need to collect intake to your basic biometric data to maybe daily check-ins and survey questions. We also organize educational content, and that's your content. It's not content that we've pulled and we have in numerous places, but it's content that you're currently providing to your patients in maybe lots of different ways. Maybe you're giving them links and brochures and pieces of paper, and we compile that into one place and organize it in an FAQ section that's easy for them to engage with. And like I said, we're supporting patients across pediatrics and adults, and it is able to be translated into Spanish. And the last thing is that the tool also is able to collect photo and video and transmit back to the care team. So in combination with those trends, you're able to get a really good view with your patients being remote. So we actually manage all the logistics. We send out the iPad to the families. We have a 24/7 help desk. We help with the design and the management of the program. So these tools, as many of you all know, when we're plugging in new digital tools into the healthcare space, it can be challenging to adapt to the workflow. And we really want to be there to support that backbone of it all and make sure that there's the support needed for the clinical team effectively, and that they're not having to take calls about the technical requirements of how the app is working or the hardware is working. We wanted to remove all those potential barriers that a patient could potentially face and the clinician might face with digital tools and support that. And then once they're done with the iPad, that's coming back to us. We're cleaning and sterilizing it and getting it back into circulation. So how are we responding to COVID? When the initial wave started to hit the U.S., immediately we started to think about and feel grateful for how we had designed our tool in a way that can be configured very easily. In the last 2 weeks, we've stood up two significant programs with two of our partners at the University of Virginia and Inova. At UVA, because of our fantastic integration with Redox and the partnership there, they actually order this service right within the EMR. A patient episode is created. And so again, because of the way we've integrated and designed that order set, that information is immediately showing up in Locus, but it's a very low lift on the clinician who's very busy, specifically right now in the front lines, trying to get patients up and going and back to home. So what we're doing is providing the tool to our partners and both of these programs specifically for patients that they're screening and they're sending off the test results. As we all know, getting the test back is varying. And so if they're presenting with symptoms and the provider in their clinical judgment feels that they're safe to go home and continue to be monitored there, either while we wait for the test results to come back, or they do test positive and need to be monitored at home and they're good there and don't need a hospital admission due to this, then they're continuing to use our tool to monitor those symptoms. And so the way in which we're getting the tool out is once the episode is created, our team is actually sending the iPad with the appropriate biometric data that's needed, pulse ox, thermometer, scale if needed, but also a blood pressure cuff. And we send that out, and then they start to use the tool, and they're immediately logged in based on the way their episode has been created. And then they, at the end of their monitoring episode, they return that to us. So in both cases, with both of our current partners, we've helped with the workflow, that design and management, really trying to, again, just reemphasizing being that backbone to the clinical team, making sure that they're getting their content and their needs addressed for their specific patient population. One example at UVA was just broad. How are we going to face COVID patients coming in and getting screened? And then the other use case is specifically for oncology patients who are presenting that are in the middle of an infusion and might need to be screened, and we really want to try to keep them at home. So we're designing those programs, getting them up, helping with the management of them, but also making sure that the tool's getting configured and it is what the clinical team had in mind and meeting their program objectives. There's a section of education that we have readily available for the patients, so we're able to provide that in a couple of different ways, either through pushing out tasks and having them read that, or we have that FAQ section I mentioned earlier, and we're loading in the latest information that the CDC on a national and state level that's being pushed out, and on a health system level. So it's very specific to what the health system wants you to do in response to being at home and being monitored. And additionally, we have the phone numbers in there that are pushing them back to their clinical team and making sure that in their alert messages and in their contact information, they're being pointed back to their clinical team in an effective way so that they're staying in touch with them. This is just a couple views at the population level. This is if a clinician logged in, they would see their entire population. They're drawn to the patients that are producing the alerts in the red, and they're able to attend to them very quickly. There's trended views also available that they're able to interact with. They can scroll and zoom, see additional notes that have come through from the patient. And for anyone out there that's interested in this, happy to set up remote demos just to walk through. There's so much that's a part of this solution and platforms, like all the great companies that have presented, but a deeper dive into a demo will help with more clarity and insight into how the tool can work. Just throwing out that we're HIPAA compliant. I know we're deregulating some things right now, but just want to point that out. Just a little bit more insight into our platform and how it is built. Happy to provide these. But just want to reemphasize that we are able to integrate across numerous EMRs due to Redox, and that we're able to configure the measurements, again, based on the population. So it could be broad for COVID, but there's also multiple populations out there that are obviously, we're thinking about how to respond with COVID. So if there's more specific information, or the tailoring of the data points needs to be more specific to their needs and how they may need help during their COVID screening and monitoring at home, we're able to do that and support it. And so with that, I want to hand it back over and see if there's any questions that I can answer.